Well, spinal surgery affects the backbone and the locomotor system, and the spine contains the spinal cord and the nerves. Now, with operations that affect the spinal cord and nerves, there's always the fear of injury to the spinal cord and injury to the nerves, resulting in paralysis after surgery, resulting in inability to walk after the surgery. Now, advances in technology have allowed us to be able to do spinal surgery more safely. For example, during surgery, we can do the operation with intraoperative neural monitoring, which means that during the surgery, electrodes are placed in the thigh, the calf, the legs, and the hands to monitor the spinal cord and monitor the nerve function, such that whenever you do an operation and something is amiss, or if the nerves are being accidentally compressed or touched, even before that damage, alarms will go off, such that we will not accidentally damage the spinal cord and nerves without being aware of the condition. Furthermore, recent advances in surgery allow us better visualization. The use of the microscope to visualize the nerves. We can magnify objects many times, such that tiny objects which are not normally visible to the naked eye can be seen. Using a microscope allows us to do precise decompression, precise maneuvers to free the spinal cord and the nerve from compression without injuring vital structures. Over and above all that, minimally invasive surgery, which is also keyhole surgery, has allowed us to do spinal surgery more safely with less complications of bleeding, less complications of wound infection, and a faster recovery, because minimally invasive surgery allows us to do the same operation as an open surgery with a very tiny incision, and that tiny incision results in the use of less incision, a smaller incision, less tissue destruction, and less bleeding because of a lesser area of exposure. Now, a smaller operation, a smaller cut, and less bleeding also allows the patient to recover faster from the operation. They can get out of bed as soon as the first day after surgery. And the smaller incision also translates to lesser usage of pain medication. So the patients will have less side effects of pain medicines like gastric side effects, nausea, and vomiting immediately after surgery. And a smaller incision will also mean less infection, less wound healing, less surface area for the wounds to heal, meaning that infection is almost unheard of in minimally invasive spinal surgery.